Hello, welcome to Quick Notes, a division of the What Is Medicine channel. This division is aimed at explaining less common diseases to medical professionals in a quick, succinct video, less than 5 minutes long, just kind of going over the basics, treatment, diagnosis, etc. This video is going to be covering the topic of visceral artery aneurysms. So who's at risk for visceral artery aneurysms? Highest risk are your patients who are atherosclerotic, pregnant patients, patients with portal hypertension, patients who have vasculopaths, all vasculopaths, anybody you'd be concerned for AAA, they're also at risk for visceral artery aneurysms. And then cardiac valve infections also put you at increased risk. So as far as what am I talking about when I say visceral artery aneurysm, visceral artery pseudoaneurysm? We have VAA and VAPA. Visceral artery aneurysms, a dilation of the arteries, the celiac, SMA, and IMA, greater than 1.5 times their upper limit of their normal diameter. This is contrast from VAPA, visceral artery pseudoaneurysm, which is typically a post-traumatic dilation with hematoma formation. Now, VAA, visceral artery aneurysms, are typically more common in female and typically more commonly seen in the splenic artery. Now, the VAPA, the pseudoaneurysms, are typically in the hepatic arteries and they're seen more commonly in males. What are the symptoms? There's no hallmark symptoms for this disease, nothing like a sheep that would point you directly into it, and it's relatively uncommon, so it typically takes a little bit longer to diagnose it. Now, these patients will typically have nausea, vomiting, weakness, malaise, sometimes pain at the area. And then we go to jump to diagnosis. How do we diagnose it? Typically you need some kind of imaging. The imaging people typically begin with is usually an x-ray, and if the aneurysm has been chronic enough, there might be some calcifications that will be visible on the x-ray, but your ideal imaging will be ultrasound, CAT scans, MRI, just to show you the dilation of that artery. Now, once you diagnose it, not all of them get treated, obviously. The less symptomatic VAAs, visceral artery aneurysms, full thickness dilations that are non-symptomatic and less than 2 centimeters, will typically be watched. Now, if it's greater than 2 centimeters, it's going to be repaired. Symptomatic, anything that's causing your patient significant pain will be repaired. All visceral artery pseudoaneurysms are repaired. And something to note, anything that has exhibiting rapid growth will be repaired, as well as patients who have these seen in post-liver transplant or any women of childbearing age. Now, how do they repair them? If there's collateral circulation to the area that the aneurysm is supplying blood to, they'll just ligate it off. If there's no collateral circulation, then they'll try to put a stent in or put a graft in to repair it. Now, vascular does this, right? So if you see your patient fits any of these criteria, it might be a good idea to get vascular on board. It might be a good idea to get vascular on board as soon as you diagnose it, just to get their input and move forward from there. Again, this was visceral artery aneurysms and visceral artery pseudoaneurysms, kind of a brief run through what to look for, how to diagnose it, who gets it, who doesn't. And please continue to watch. More videos will be coming soon. Thanks for watching.